Hi, this is Jessica DeMassa, and I'm here at the HISA Studio at HIC 2017 with probably HISA's most famous face, Miss Louise Schaper. So introduce yourself for everybody watching.
Hi everybody, I'm Louise Schaper and I'm the CEO of HISA.
Fantastic. So talk to us about the conference. How did it go this year?
Well, I don't know if you can tell, I probably look like a complete dork on camera because I just can't get this smile off my face. So we've been here for 4 days and it has gone so well. I'm getting nothing but positive comments. People are still hanging around. People have just had such a good time. The content has been so rich, and I'm just so excited that everyone's had such a great time here.
Fantastic. Are there any moments that stick out for you as particularly memorable this year?
Oh, that's a tough one, because I don't want to offend anyone. Yeah. Look, I actually think every year we have a selection of keynotes that are hand-chosen by the committee, and sometimes they land and sometimes they don't, and that's fine. Like that, just some people love one type of talk and other people like a different type of talk. This year, everyone is just raving about our keynote speakers and how they've been put together and the stories, and I think they've all done such a fantastic job, and I just couldn't be prouder.
Oh, good. No, we've been hearing that too here in the studio, and picking up a lot of the key themes that are here: workforce preparedness, patient-centered design, UX design, some of the big things that have really come up in those plenary sessions. Is there anything else that stands out to you?
I really think the workforce stuff is really important, and I see that coming again and again. So this morning, for instance, we had Tim Kelsey give the first speech that's ever been given on the digital health strategy, because it was launched a few days ago.
That's right.
And one of their 7 pillars is workforce, and they're really and so to have the Australian government, which is unusual, it sounds like a no-brainer, but it's actually never happened before, where the focus has been on infrastructure and, what are those building blocks that we need, and they're crucially important. But you know what? We need a workforce that is confident in using digital health technologies, and we also need a workforce that is specialised health informaticians and clinical informaticians who will actually help chart the future of healthcare in Australia and improve things for patients and clinicians. And so usually that's just us saying those messages and saying, would someone please listen? So to have the most senior person in digital health actually give not only his support, but the support of the entire digital strategy for Australia, it's a great thing, and I know
moment.
It is. It really is, and so that was a real highlight. And
truly, in the room, you could hear a pin drop when he was speaking. I mean, it was very quiet. Everybody was very enraptured in what he was saying as he laid out the principles of the digital health strategy. It was a good moment.
No, it's good, and I think next year the conference will be in Sydney, and because then we'll have 12 months of the digital health strategy. So I think we'll have a lot more to talk to people about, and some real laying down foundations in terms of workforce reform and upskilling the entire healthcare workforce. And so I'm looking forward to reporting back to you next year.
Fantastic.
Where we have a whole lot of things that we're just on the cusp of going into, I think.
Oh, such a tease. We'll have to see. We'll have to watch with bated breath as information unfolds and comes out of HISA about the program for 2018. Louise, it was so great to speak to you. I know you've got to dash off, but thank you so much for joining us in the HISA studio. You're our celebrity guest of honor.
Hardly.
No.
Well, let me first, actually, I know you're trying to wrap up, but I just wanted to say that I met Jess about, 10 days ago or something, and you had this idea of coming here and filming, and again, thank you so much, because and we built all this branding around it, and now we've got a whole nother way to communicate with people about the things that go on here, and you're a big part of that this year, so thank you.
Lovely, thank you so much. That's so sweet. Thank you so much. Oh, thank you. We've spoken to almost 50 different thought leaders at this conference, 50, so somebody has to watch all of that.
And have you drunk much caffeine to get you through all of this?
Yes, thank God that HISA has a sponsored coffee station right across the way to keep the energy up. But it's been phenomenal, and I really feel like the digital health community and the health informatics community here in Australia, which is very different than in the US and in Europe, it's growing, and there's so much enthusiasm. So it's been a delight to just hear everybody from their different parts in the health ecosystem here, 50 different opinions about what's going on and what's hot, and so I hope everybody at HISA enjoys it.
Excellent.
Thank you so much. Thanks for having us. Thank you. For the last time here, this is Jessica DeMassa at the HISA Studio at HIC 2017. Thank you.